So I'll go ahead and introduce myself while my handouts are being passed around. I'm Dr. Liesa Harte, and I have my medical practice in the Lamar Plaza Drugstore, which is at 1132 South Lamar in near South Austin. I'm an MD. I went to the medical school in San Antonio, and that's where I did my residency in family medicine as well. For a long time, I was just a regular family medicine doctor, but I got burned out having my patients tell me that they were experiencing all these symptoms that I wasn't trained to know what to do with. And so that bothered me because I believed them, I just didn't know what to do about it. And I honestly got burned out, and after about 6 years of practice like that, and I moved to the south of France, and I was determined to get my license there, and I'm not an EU citizen, so I finally gave up on navigating the bureaucracy, but I did work for free part-time while I was there, and I learned a lot. I learned a lot about a much more holistic, integrative approach, and so I do have 6 children, and by the time I got back, my children were a little bit older. So I had a little bit more energy to invest in figuring out how do I get trained to know how to help all these patients that I'm so frustrated because I don't know what to do for them. And so I discovered the Institute for Functional Medicine, and I've been certified by them. I get a lot of training. I'm a training junkie with functional medicine. And has anyone ever even heard of functional medicine? Anybody? You? Okay. Anybody not heard of functional medicine? Okay. Functional medicine. So regular medicine, and I mean, I'm an MD, you know, that's pretty good, and good training, keep my board certification up. Well, the way it works, if you really want to know, is the doctor listens to you just long enough to know, okay, which label am I going to slap on this person? And that's a diagnosis. And then, I don't know if you've ever noticed, but they really stop listening to you then, and they're writing, they take the prescription pad out and they're writing, okay, what can I give this patient? It's probably not going to hurt them, and get them going. You know, appease them for a while and get them going. Now, if you have a strep throat, that's great, you know. You can treat that with penicillin if you're not allergic, and that's appropriate. But what if you have fatigue? What if you have headaches? What if you have mood swings, all these sort of things? Well, I mean, what do you do about that? A lot of people are given an antidepressant. They're given out like vitamins, and that's it, and send you on your way. You're not really counseled on all the side effects that you might have from the antidepressant, including like it wrecks your sex life, and it may get rid of the low lows, but it also gets rid of the high highs and kind of compresses your emotions. And a lot of people are just as bad off as they were before they went on the antidepressant. That's just an example of how it is with allopathic medicine, which is, if you go to most doctors, that's what you're going to get. So the functional medicine approach is we're very good listeners. We tend to have a lot longer office visits. And I'm listening, and when I'm listening, I'm thinking of all the things, and there are usually several, that can add up to cause you to be experiencing what you're experiencing. It's very rare, unheard of really, for one thing to cause what you're experiencing. I have to take into account, what about your stress level? What about your nutritional status? Most people think they have a great diet. Well, you know, I do a lot of nutritional testing, and it's very common that B12 will be in the basement, and you know, my patients may not realize, but there's a very common SNP, which is a single nucleotide polymorphism, which is a fancy way for saying the variation between one person's DNA and another that can cause this other person to need several times, even 100 times more B12 than this one. And it might need to be in a different form. It might need to be already methylated, because there can be problems with that. So I do a lot with nutrition. But a functional medicine doctor takes into account, are you exercising? If so, are you over-exercising? Are you doing aerobic and resistance and stretching, meditation? Are you taking care of yourself in a balanced way? Okay, what about mood disorders? I mean, probably everyone in here knows someone who has been diagnosed or treated for depression, anxiety. Okay. Well, what can cause that? Hormonal imbalances, neurotransmitter imbalances, even a deficiency of vitamin D. It's a huge risk factor for depression. Who would have thought? What if you only eat really bad quality fats? Your cell membranes in your brain really are hungry for those omega-3s that Dorinda was talking about. And there are just so many things that affect what you're experiencing. So for functional medicine, we take into account all these things, and I always have a 3-tiered approach. What do I need to take care of right now? And then once I get that sorted out and equilibrated, which takes usually 4 to 6 weeks, what do I want to approach next? What do I want to attack next? And then when we get that done, then you'll be good. But how about taking good to great? Or, you know, why does good enough have to be good enough? How about optimal health? Because I have an optimal health practice. I'm not satisfied with just the absence of disease, because I believe in the concept of organ reserve. I mean, that's the reason people don't just suddenly one day get colon cancer or an autoimmune disorder like lupus. It's building up over the course of many years. So what if we could intervene years in advance and get off the freeway that's leading us to that? And does anyone know anyone who has Parkinsons, for instance? And do you know that 5 or 6 years before the diagnosis of Parkinson's, the patient loses their sense of taste and smell? So why don't the doctors test you for taste and smell? You know, and then if you've lost that, often the intervention for that is certain B vitamins, certain minerals. So anyway, I guess you can tell that I love what I do, and I like to deal with bioidentical hormones, nutritional issues, mood disorders. I rebalance hormones. I only use bioidentical. I refuse to write for anything that's not bioidentical. I rebalance neurotransmitters so that I don't have to write for an antidepressant or an anti-anxiety medicine, except as a bridge while we take care of some other things, or as a last resort. Of course, some people need those, but it's a very small percentage. You'd be surprised. So I give exercise prescriptions, and I give a lot of homework too. But anyway, and now I just want you to know that I consider myself the libido doctor. I'm launching my book. My book will be available, if I have anything to do with it, by the 3rd weekend of March. And I've given you a 2-page handout on just an outline of what can go wrong, because women's libido issues are very important. Some days, half the patients I see are there because they don't really have a libido, and it may not be causing them a problem because they don't have one, so they don't care. But it causes problems with relationships, and sometimes it does bother the woman. That's always makes it easier. On there, you'll notice I have this online assessment that I'm going to have that will suggest you areas that are high probability, possibility, and unlikely for what could be causing your libido issue or friends, and then what to do about it. So if you're interested in having access to that, you can email me at this email address listed here. Put in the subject line in all caps Libido Pro, because I get probably 300 or more emails a day, and I'll make sure that my assistant sends you the link so you can do the assessment for free.
I have a question for you. If you were to try and pick which category that you address most, would it be like the nutrition? Would it be like what do you find that's the most differential that you can change? The majority.
It depends on why a person comes, but it's usually nutrition, hormones, and neurotransmitters. Just because functional medicine is not one thing, causes one thing, it's the balance. I rebalance all of that. I rebalance your whole body. And we're a web, you know.
Speaking, I mean, what do you find
Pardon?
there? Psychologically speaking, I mean, I know if you feel good about yourself, it transmits, but I mean, how do you feel about that? Just in terms of libido and partners and...
Oh, over half the people who have libido issues, it's for a problem unrelated to their nutrition or their hormonal status. It can be that the patient is too tired, which may or may not link back, ultimately to nutritional or hormonal issues. But it's often boredom, anger or resentment with their partner, a lot of things. And you'll find that listed on page 2 of that list. But the thing is, I can teach you how to have a great sex life with someone that you're angry with. Because it's all about you after all. I mean, really. And if you change you'd be surprised. If you change yourself, you're going to automatically change everyone and their reaction to you. And I can teach you how to do that. So, and then on the 3rd page, or the second handout, I think you'll find this really interesting and overwhelming, and that's why you need to come to Dorinda or me to help you sort out your hormones. And we always test. When I went through medical school, no one tested hormones, but I would never treat a person's hormones without knowing what levels they have, and it's about rebalancing. But this is really cool. This is actually for clinicians, so it's for doctors and other people who provide services for the hormones. But if you look along the left-hand column, there are all these symptoms that you might be experiencing, and then that middle hormone, it tells you the possibilities. And there are probably some things that are left off, but this is a pretty good form. For instance, as far as hormones for decreased sex drive, it could be because your estrogen's too high, it could be because your estrogen's too low. It could be because your progesterone's too low, your testosterone's too low, your cortisol is too high or too low, or your thyroid's too low.
Well, I will tell you, it's funny because I went to an endocrinologist because they wanted to test me, and they said that I had a low testosterone. They're going to make me take this little pill every day. I'm like,
well, I wouldn't take a pill anyway.
They tested me in the levels. I mean, and then I was like, I'm not. And
Was it blood work or saliva?
It was blood work, and they said it was hereditary. And I was like, I'm not doing this. I'm not taking it. And then it went back down, normal. I quit taking the pill. I was like, no, there's no way. But it's funny though that they would take blood work and say that that's.
And they said that about your testosterone or your
hereditary.
Or your thyroid.
Testosterone. They said it was hereditary.
That it was too high?
That it wasn't high enough.
Oh.
And I was just kind of surprised, and they said that it was hereditary and wouldn't change, and I'm like, and just started doing different vitamins and stuff, and it changed. So
I have a lot of herbal products that I can put people on as well, but yeah, and we're fluid. Things do change,
yeah.
I could have a long conversation with you on how cool it is the way they change, what causes things to change. Hair loss. Oh my gosh, there are several things that can cause hair loss. I see a lot of patients for that. Sleep disturbances, that's a big complaint. Memory loss, that's a big complaint. And anyway, I think you'll have fun with this. I don't expect you to be able to self-diagnose. You'd have to have the levels, and but it shows how complex it is. I do some HCG weight loss, and I put some information there in case anyone's interested. I do a lot with stress. Stress contributes to about 90% of diseases and illnesses. It's not the direct cause, but it's a factor. The stress hormone is cortisol. And cortisol, if you keep pumping it out all the time, it's like always running from the bear. You deplete your adrenals. Elevated cortisol raises your blood sugar. It lowers your immune response. And anyway, stress is bad. The cortisol also makes it hard to make short-term memories and to retrieve short-term memories.
What's low or high cortisol treated with? Supplements?
It depends on how bad it is. And cortisol varies during the day. So a blood cortisol level is really not very helpful at all unless it's extreme. Sometimes if a person's on a really tight budget, I'll do the blood first just to see if it's really extreme, but you don't know too much. Cortisol starts out highest in the morning if it's normal, and then it drops pretty quickly, but not like a rock, by midday, and then by evening it should be almost gone. Should have almost none. Cortisol is important for maintaining blood pressure and for making you feel like you can hop out of bed in the morning.